Oh, we are back, 8:44 this morning on Start Today. We're going to debunk some common fitness myths that you've heard about for years, probably. They're now being spread on social media. Dr. Jordan Metzel is a sports medicine physician from the Hospital for Special Surgery. He's here with us to help us decipher what's true, what's not true. Always good to have you, Dr. Metzel.
Nice to see you. Thank you.
So, I mean, first of all, let's just maybe start with why these myths are, in fact, so common.
Yeah, well, it's the way we get information. In the old days, you may have talked to somebody or read it in a magazine or a book. Then along came the internet, and Dr. Google is right about 30% of the time. Now we're in the era where social media influencers, just because they look a certain way or they have a certain number of followers, they give health and fitness information. People think, well, they must know because they're an influencer. In fact, their rate of success is much lower.
What do you know? The internet, responsible for misinformation and disinformation.
Amazing.
Let's start with some of these myths. First of all, being thin, better than being active. What say you, Dr. Metzel?
I say big false here. So the issue here is that people think just because you're thin, you're healthy. But in fact, the opposite is true. A meta-analysis, a combination of multiple studies, was just published in the last 5 months, looking at health outcomes in people who are thin versus people who are active and mild to moderately overweight. And surprisingly, if you're active and a little bit overweight, you're much healthier across your lifespan than if you're very thin. So the emphasis here is we should do something that I want you to think about being active, not being super thin. And people have the best compliance when they do something they like.
Find an exercise program that you like.
Yeah, it makes a big difference.
All right, let's tackle another myth here, perhaps. Running will destroy your knees. True or false?
Well, again, another big false here. I love running, and I have a lot of my patients that run. People think you're going to destroy your knees if you run. No evidence that's true. A number of big studies, population-based studies, looking at the incidence of arthritis in hips and knees, runners versus non-runners. Runners have about a third the amount of arthritis compared to non-runners. But if you have ongoing aches and pains, you definitely want to get them checked out with your doctor.
Okay. I actually did think that as you got older, running was bad for your knees. All right, so moving on. Stretching. Oh, no, hang on. Exercising in the cold. This is especially important on a day like this here in the Northeast. Exercising in the cold, bad for your health. True or false?
Big false here.
Okay.
So the key is preparing your body to get out and exercise in the cold, getting your lungs warm, especially if you're an asthmatic, doing inside exercise, getting ready to go out. But there's really no negative health risk at all of exercising in the cold if you do it properly.
So you just got to bundle up.
Bundle up and warm up inside.
All right, this next one now, listen, stretching. I always thought that stretching before you exercise actually reduced your injury risk. Is that not true?
Not true at all. So, in fact, stretching has got a great PR campaign. It doesn't do much at all. The key thing is strength training reduces your injury risk. So stretching when you're done is great, but strength training is more important. We want to get people doing a dynamic warm-up, jumping jacks, walking lunges before they get out and move.
Okay, all right. Last but not least, arthritis. If you have arthritis, you shouldn't exercise.
Well, again, I see this all the time in my office. People with arthritic hips or knees, they think I should sit on the couch. Actually, the opposite is true. The stronger your muscles are around your hips and your knees, the better your arthritic joints will feel. We want people who have arthritis to get out and move and strengthen muscles so they can do their activities.
So don't use the arthritis as an excuse not to work out.
It should be a reason to work out.
All right. Thank you so much.
Thank you.
Dr. Jordan Metzel, always appreciate you, sir.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.